So our fourth year is completely unlike any of the others. So we're not in a classroom pretty much at all. Well, we're not in the classroom. And what we do is we go on different rotation sites. So like before we came, I had a community rotation where one big difference between our community rotations is that we give vaccines in the pharmacy. So like the pharmacies that we go to, they love that we can give vaccines because it's kind of time consuming for the pharmacist. So we gave a whole lot of the influenza vaccine like right before we came. And then we also have hospital rotations. We've all had different. So the school lets us give our preferences. So like Liz wants to do a residency program, Janie wants to work in a hospital, and I want to work in community. So they let us have a say in how we want to spend our fourth year. So if we want to do more community, we can, and the school really tries to work with us to kind of tailor the school to fit us as best as they can. Do you want to? Okay. All right.
So this maybe would have been helpful earlier in the presentation, but this is a map of Alabama. See, Mississippi and Florida are neighboring, and we're right on the Gulf of Mexico, the coast there. But the first little yellow dot is Auburn, where the main campus is located, and the yellow dot that just popped up is where we are. So we're in Mobile, right on the coast. And here's our first day in High, or second day technically, our first normal day after recouping from jet lag.
So now we'll kind of start with how our orientation week to Haggai. This was a really good introduction, so thank y'all for taking us. So our clerkship started here on November 12th. Some things we did to the orientation week. So we had a really busy week seeing a lot of different areas in the pharmacy. So we got to meet the dean. We went to the PICU. We went to a couple different units. We went to the NICU. We spent some time in the TB clinic. We also saw the outpatient dispensing pharmacy, which is really different from our pharmacy. We have many dispensing pharmacies in the U.S. So we don't have quite as many people that come to each pharmacy like here in the hospital. But that was really interesting for us to see and how efficient that it could be as well to have so many people. We also got to see chemotherapy, which was really interesting. We got to garb up. And also the TPN room. Okay, so this is just a recap of our first week. So we've kind of read through each one, but we also saw the ER pharmacy, the Drug Information Center, and the ADR Center. And so the next couple of slides are just going to be pictures of us there. So Kelly, I think, has a couple words about this. So this probably looks like really obvious to you. You've all seen it 100 times. This is actually really different for us. So here they have like stations. So the technician or assistant, I believe, assistant's what you call them. We call them pharmacy technicians. So they stay at one place. And we thought it was really cool how you have the system of how you can find a drug. So you could go to the C and then go to D. And I know it's normal for you, but we don't do that at all. So ours are all alphabetical, and the technicians the assistants don't stay in one area. Our pharmacy, they just run around and they kind of memorize where the drugs are. So they get quick. I mean, it sounds inefficient, but they do get very quick. But we thought it was like really smart to have them in one certain like location that you could find really easily without having to remember the brand or generic. I know y'all think this is so simple, but we thought it was amazing. So, another thing, even though we have pill counters, we don't like pre-count pills. So we would wait until the patient had a prescription for like 360 tablets, and then we go put it in the machine. But we thought it was really smart here how drugs that are used commonly, they go ahead and put them in, like, they may go ahead and count 30. That way if the patient comes in with 30, 60, or 90, it's just quicker to grab the bags. We thought that was really efficient. We were impressed. So we also thought it was pretty interesting to see the different snake venoms here. Since I have had a little experience in the hospital back home, we definitely don't have some of these. anti-venom that covers for many different snakes. Mostly ours is for rattlesnakes back home. But we thought it was pretty interesting how many different types of anti-venom were here.
Okay, so this is one of the days where we got to leave for a bit of a break midway through the day, and we checked out the Natural History Museum. So that was a lot of fun. We tried to sneak in as many. We thought you guys would like pictures of you guys in here. Hello. So we thought it was hilarious, not really hilarious, but very funny that you guys also used a bureau. This is our main textbook, our 3rd year, and a huge resource. So we wanted to get a picture of it. We were also impressed too by the drug identifying binder for you guys to be able to quickly look up a medication. Generally, we just look and we Google to see what drug a patient might have. So this was really neat to us. So we're sure to take a picture of it. And this is us garbing up when we were helping in chemotherapy and observing that day. So we were really impressed with the setup and how many stations you guys have and the actual hoods. It's a little different for us though to walk into a clean room barefoot, so that was a different experience. We normally wear shoes. It's just different. Otherwise, the same procedure. All of the garbing up was exactly the same, putting on your coat and your mask and the gloves. More pictures, and we had to get a picture together as a group. Okay, so this is the day that we visited the outpatient pharmacy, and we were really impressed with the setup, and we focused a lot on the Thai herbal medicines. We had lots of questions about that. And PA helped us. She was showing us there a book for the controlled substances, the law that you guys have your patients sign. So to contrast that to the US, we really only have patients sign that if they're signing out like pseudoephedrine. We don't do it for all controlled drugs. So that's something that's really different from the US. It would be hard. I feel like we dispense a lot of controlled medications. So not every patient has to sign like that. Okay, so now we're going to turn towards talking about our each individual rotations and the units that we were in, because our first week was spent as an orientation, and the next 3 weeks were spent in different locations in the hospital.
Okay, so Janie and I, our first week staying in one unit, we were in nephrology. So to begin with, we just toured the unit. They kind of walked us through some of the procedures, and then some of the things that we reviewed here were the KDIGO guidelines, which is what we use too. But we also looked up a few different guidelines. So like at home, I would honestly never search Japanese guidelines because that really doesn't apply to a lot of our population, hardly any. So Tom he kind of had us look at more international guidelines that we would never look up at home. So we thought that was really interesting. Also, a lot of international guidelines, like they have different standards. Even the BMI classification is different in Thailand. In America, you can have a little more weight on you and not be considered obese. Here, it's a little more strict. We talked a lot about like hemodialysis versus peritoneal dialysis, because at home, pharmacists aren't really in the nephrology unit. So we don't learn a lot about it. We thought that it was really great that the pharmacists were as involved as they were here in the nephrology unit. We also kind of throughout the week, we had some downtime at the health science library that we got to go around and kind of look at some books about Thailand's healthcare. Something else that we really thought was neat was that we got to go see a peritoneal dialysis patient. And all 3 of us were able to be present for that. And that's very different for us because pharmacists in the US just don't make home visits normally. But we thought it was really efficient and a very good use of a pharmacist's time to make home visits like that, especially for patients that aren't able to come to the hospital as regularly. Okay, so my first 2 weeks were spent in the hematology unit with Pecan,
And I have rounded with the hematology team along with 2 other pharmacy students, Prowl and Yip. And I particularly followed one patient case so that I could work up that patient and then do a patient presentation. So I did that at the end of that rotation. And I also got to observe several of your presentations throughout the couple of weeks. And the majority of what I reviewed were the NCCN cancer guidelines for acute myeloid leukemia. And I also got to attend the hematology grand rounds. And I don't think the picture made it in there, but we got to look at a lot of microscopy with a really neat microscope. And feel free, guys, to stop us at any point if you guys have questions or comments, okay? So here are some pictures we'll talk through.
Yeah, we just had a couple pictures from the home visit. The patient didn't mind us being there. He gave us permission to take pictures, by the way. The nurse pretty much just watched his procedure. She wanted to make sure he was going through the process correctly, and she wrote down notes, and she had a checklist to make sure everything was being done correctly. And then he went over his medication. So they talked about adherence and understanding about what the medications were for. This patient is very compliant, very knowledgeable about his condition. And then we got a picture in front of the house. Alright, so the next place Janie and I were was the neurosurgery unit. We each had our own team to round with. And so we followed a couple patients that had like the most going on for the whole time we were there. And then we also prepared patient presentations based on patients that we saw in the neurosurgery unit.
So I primarily got to focus on subarachnoid hemorrhage, which is really interesting considering we don't see many cases of that, and I actually saw many cases of it when I was rounding in that unit, and I was with Natty, and Kelly was with Emmy. Something else that we thought that was really interesting was that we saw many ADRs. While we were in the unit, and apparently that's not a normal thing, that apparently it was just because we were there, but there were many ADRs, and we got to make timelines for them, which we thought was very efficient as well, to take the extra time to write everything out. That's something that we don't necessarily always do in the States. And we got to go to the bedside and see the patients and the specific rashes, and we don't always get the chance to do that here.
Okay, so after I finished in hematology, I went to the medical intensive care unit with Ben and Sway, those 2 students, and P. Pang was our preceptor. So I got to round with the medical team for a week and discuss the patient cases after rounds with P. Pang. And she asked a lot of good and challenging questions because I had been on an ICU rotation at home, but I really hadn't seen the same type of patients and the problems, so I got to learn a lot. And we also reviewed some of the important primary literature and pertinent literature for critically ill patients. So I'm sure you guys, or the majority of you, are familiar with the FAST-HUG acronym, and then some of the relevant studies too for just stratifying severity of patients and how ill they are. We also reviewed some of the new sepsis criteria, sepsis and then sepsis shock, and then some of the scoring systems too, Apache, SOFA, and all of that. So I learned a lot.
So now that we've talked about some of the units or the wards that we were at, we just wanted to say a couple of the big differences between the Thailand healthcare system and in the USA. So the first huge difference is that a lot of patients here have the universal health care. Whereas most patients have like a private insurance, or if you are poor or old, you can have governmental insurance. It's really still not as good as the universal coverage from what we see. Like most of us are covered either through our parents' employers or we have to purchase insurance, so it's very expensive. Also here, like I know the universal system, you can even add, like if you have coverage, you can add a parent. So at home, we can't, that doesn't happen. If you have insurance through your your company, you might can add a spouse or a child, but you can't add any other family members. And the more people that are on your insurance, the more you're going to pay every single month. So it's really complicated. Thailand seems to be a lot more straightforward and have better coverage for more people. So it's a really big difference with how people are treated with their care.
I think that might explain the volume. So Jamie talked about earlier how large the outpatient pharmacy is and how impressive it was to us and the efficiency of it, the stations and everything. And I think that's really necessary because you guys see so many patients because they have available health care. I think a lot of patients in the U.S. are prohibited by cost to really come and seek a healthcare professional's advice and treatment. The other huge thing that we noticed right off the bat is that this hospital, this center in particular, has a lot of outpatient services. So with the TB clinic, the HIV clinic, there's several others. So like there's optometry and dental. In the U.S., it's normally far more divided. It's not all in one central location like that. So that was really interesting for us to see. And I think interesting for you guys because you have more of an opportunity to have a role in those settings. So we didn't have a whole lot of nephrology experience. I had zero hematology experience because not all of it is at one huge center. So we were impressed by that. Here's a little bit more about fun stuff we've done.
So now we've gone through most of the harder stuff about the rotation or our actual learning experience, and this is kind of just some of the things we did extracurricular. So we thought everybody took really good care of us and made sure we had fun and stuff to do in the evenings. So this was at the Louis Vuitton. Is that wrong? I don't know how to pronounce this, but we had a lot of fun making our little basket flower thing.
So just some of the things that we've done on the weekends thus far, we have really traveled around. So every weekend we've gone somewhere new. So we went to Songkla Town, which is where we saw Naga. And we also went to the top of the hill where we saw the Love Lodge. I can't remember the name of the hill specifically, but the Love Lodge was really cool. The next weekend we went to Koli Bay, which is awesome. That is our most favorite place so far in Thailand. It's probably the prettiest island that we've ever seen, even after going to Phuket this weekend. But that was pretty nice to have a whole weekend there, and then we also had Chiang Rai, which is something that we decided to take an all-day bicycle tour to do, which was about 50 kilometers. And it was pretty intense, but we made it. And we went to several of the temples. We went to the White Temple, and we went to the tea plantation. And then just this past weekend, we went to Phuket. And the majority of the time, we toured the last day, but we kind of just stayed on the beach for the couple of days and got a little relaxation in. It's very beautiful.
This slide was supposed to be titled some of our favorite things about Haggai. We went to the movie theater just once and we thought it was amazing. We love the coconut ice cream that's in the sandwich, the coffee, and the desserts. We get cravings a lot. So that's just, yeah, pretty much everything we just said. We love the mix of sticky rice, the coffee.
Okay, but besides food, we really enjoy going to the reservoir. These are our favorite things in Hot Gas specifically. So we love the reservoir. We wish we had someplace as beautiful as that on campus. And also your movie theater blows ours away. So it was expensive even to us, but it was way nicer than ours at home. And we were also impressed with your mall. Your mall's way nicer too. Okay, so now we're going to talk about, we were over here during Thanksgiving, and our preceptors were kind enough to let us come and try to prepare a Thanksgiving meal. So this was a group picture of us after we cooked, and it was really neat. It was really neat because everybody kind of joined in and helped. So we had a variety of things, and we also had decorations. We had some awesome little coloring sheets provided by the preceptors, so we wanted to thank them. And here's a group picture after we made bread, which in the U.S. is very basic, and almost every meal will have some form of carbohydrate. But it was funny to us because they were actually really impressed that we put butter on a piece of bread and toasted it, and they were excited to try it. Yeah, it was good. So here's in Shanghai at Rangpur Temple. I was close. So here's a picture of us there. We meant to include a picture from dinner. So all the Thai students that we had throughout the rotation were kind enough to all gather up with their schedule and take us to dinner a couple of nights ago. So we really wanted to thank them. It was really nice and we appreciated it. And here's the end of our slide.
Yeah, so we've had a really great experience. We just want to thank Dr. Stevie Horn especially for taking us on, and it was a great experience. I'm really glad that we came. And the students, thank you so much for translating. We're sorry we don't know Thai. We're glad you know English, and we couldn't have done anything on the awards without your help. So we really appreciate it. All right, so now, does anybody have any questions? ข้อ2ข้อดีไหม
What's better between Thai healthcare and US healthcare?
So what do we think is better?
Yeah, what better?
So I think in general, I think it's great that the majority of the people here in Thailand have access to health care. I think that's one of the biggest barriers or problems the U.S. is currently trying to fix and has been for a long time, is that not everybody has health care. So for the U.S., I think it's an issue of funding. So how are we gonna pay for people who can't afford health care? So I think that's the biggest thing. And I think that you haven't really sacrificed quality to provide that health care. So I don't know how the U.S. is gonna resolve our problem. I don't know if we're gonna have to kind of follow in Thailand's footsteps. I'm not even sure how it's possible here. I think that's something that we were just kind of blown away by, because we can't figure out how to pay for and provide to all of our patients. That's for me though.
So something else that we just thought was awesome was how much involvement pharmacists in general have for every single area. And I wish we had more of that in the States, and I definitely think it's better here just to have so much pharmacist involvement, because everything's better when a pharmacist is involved, right?
I would say you can tell that the patients here have a little more respect, I think, for the doctors. So where we are in America, it's very common to get a second opinion, and that means if you go to one doctor and you maybe don't like what that doctor says, you go to another doctor to see if he tells you something that you like better. And here, I thought the patients were very respectful. Whenever the doctor walked up, they were on their phone, they put it down, or actually paid attention. So I think think there's maybe a better relationship between the doctor or pharmacist and the patient. At home, it's still good. Pharmacist is still a very trusted profession in America, but here I think it might be a little more.
What other questions?
One more question.
It could be about pharmacy school, it could be about whatever. It doesn't have to necessarily be about comparing healthcare. Anything about the U.S.?
อยากรู้อะไรเกี่ยวกับบ้านเขาบ้างไหมInteresting place in the US, right?
Sure.
I like to
Yeah.
travel. ไม่มีจะจบแล้วนะ โอเค
Thank you guys for your